Hey everybody, this is OT Steph doing another live stream Q&A session right here on the Raising Beautiful Little Minds Facebook page. So yeah, come on, join me, don't be shy, ask me questions. I'm here to ask questions too. So yeah, I'm just getting set up here. And if nobody asks me questions right away, I've got a list that I'm gonna go down of questions people have been asking throughout the week. So, alright. So yeah, come on, join me. This is the OT Steph Raising Beautiful Little Minds Facebook page live Q&A session. If anybody has any questions, feel free to type them in the chat bar. I'll see them pop right up and I'll be able to answer them for you. Well, I will do my best to answer them for you. As an OT, I don't necessarily know everything, but I can do my best and try and answer your guys' questions the best to my ability. It doesn't look like we have anybody asking anything just yet, so let me take a look at my list here, and maybe I can start talking about one of these questions that came in during the week. Here's a good one. Alright, let me get this set up so I can display it on the screen. And the last 2 weeks, I've been doing this every Saturday. The last 2 weeks we had several good questions, and we're actually all the way to question 13 right now. So started with question 1 2 weeks ago. We are to question 13. So when I put it up on the screen here, it's going to say question 13 just to help me keep track of how many questions I've actually answered for you guys. And then eventually I would like to make them into individual videos for those of you who wanted to look back and maybe get a particular answer to a particular question. Eventually. That's all in the works. But this is the first question. Maybe I can make that a little bigger. Hang on. Let's try this. Okay. That's a little better. So, this was a question brought in by someone during the week, and I figured I'd start with this one because it's a pretty simple question. My son hates labels in clothes, and should I cut them all off? So, this whole thing, I think it's going to depend on how old your child is, and also how severe the hatred for these labels is. So, if they wear a shirt with a tag, are they going to be able to still function throughout their day? Is it going to bother them so much that they're unable to focus on schoolwork, or, maybe they're doing some strange behaviors at school, like taking their shirt off just because they can't stand the tag? Then I would think absolutely yes. I would remove the tag to allow your child to be more functional. And there's actually a couple of name brands of clothing that will, if you do a quick Google search, I'm sure you'll be able to find them, but they make the clothing with the tag actually printed on the shirt instead of hanging off the shirt on a piece of paper for that reason. I mean, it's not just children. I know adults who can't stand the feeling of tags and random things touching their skin like that. So it's not just a child thing, but I think it would be a good idea to allow your child to be more functional, more comfortable, that kind of thing. Now, if it's something, it goes a little bit beyond just tags where, your child is having difficulties just tolerating clothing in general or certain textures that impede their functionality throughout the day, that's when I would say you don't want to continue to cater to your child, because then they're going to develop a crutch for that kind of thing. So, for instance, if your child does not like the feeling of wet textures to a point where they aren't able to wash their hands at the sink, I don't think that you should just switch to dry soaps or hand sanitizer. I think that's something more that needs to be addressed and worked on through exposure therapy, which is exposing them little by little until they're able to tolerate that texture a little better. But as far as tags on clothes, if that's the only issue and, they just don't like it. I mean, I know adults who don't like it that cut their tags off their clothes, so I don't think it would cause too much of a problem to go ahead and cut those tags off. And it looks like we have another question coming in, so let's see. So this is a good question, and I'm going to set it up real quick. Just to stay organized. So the question is involving ADHD. Let's see. My son has ADHD. He gets very upset when he has to leave the playground. How can I ease the transition? So, there's a couple different things you can try. Not every solution is going to work for every child in every situation, but there are a couple different things you could try to do just to kind of make it a little easier, that kind of thing. One of those things is make sure that he knows ahead of time. He knows what to expect before you guys leave. So even if it's something like, if you know you're going to leave in 5 minutes, maybe call him over and let him know, hey, we've only got 5 minutes left. You maybe only have time to do this or this, and then it's time to go. Give him that warning, because sometimes a child will take that a little better than, right when they're in the middle of play or they just started a new game with a friend, and then you saying, okay, now it's time to go. So if you give them that little cue ahead of time, that little warning, like, okay, you've only got 5 minutes, they may be more prepared for the transition out of the playground. Something I use with the kids at the clinic a lot, which seems to help quite a bit, is phone. If you have a phone, it probably also has a timer feature or a stopwatch feature. And what I'll do with the kids in the clinic is I'll actually have them help me. Okay, we're gonna play in the play kitchen for 2 more minutes, and I'll set it up on here, and I'll have them hit the start button, and I'll tell them once the timer goes off, that's it, that's time to go. And I'll give them reminders throughout, like, once you hear that timer, it's going to be time to go, it's going to be time to go. And it kind of gets them in a more prepared state for leaving a preferred activity. Another thing you could do is, so positive reinforcement is always going to be the most effective behavioral approach to anything, versus a punishment. So instead of, okay, it's time to go, and now he's throwing a fit, instead of saying something like, okay, well, you're not going to get TV when you get home, or you're not, we're not going to go for ice cream anymore. You want to try pairing the activity that you want him to do with some sort of reward. And it doesn't have to be a big reward. It doesn't have to be, you go for ice cream or you buy him a toy or anything like that. It could even be something as simple as, when we get home, we're gonna have 5 minutes of reading time with mommy or something like that. So prepare him ahead of time. Say, look, when the timer goes off, or in 5 minutes, we're going to leave. And if you can leave, like a big boy and not cry and not throw a fit, and we go right to the car. And guess what? When we get home, then we're going to get to read a book together. Or when we get home, we're going to watch your favorite show on TV, or just something small, something simple, but something meaningful to them. And then in their head, they're working toward that. They're like, oh yeah, when it's time to go, I'm going to go because I want that thing when we get home. Now, it doesn't always work. So, what you want to do if you make a situation like that. So we're going to read when we get home, and then it turns out that they don't have such a great transition out of the park. Then you need to be consistent and remind them when you get home that they're now missing out on this fun activity because of the way they behaved. And a lot of parents will say, well, isn't that going to make their behavior worse? Isn't that going to cause more tantrum and more, and the answer to that is yes, it is. It is going to get worse before it gets better. But that is part of a child learning consequences. They are going to try and continue to test the boundaries, to push the limits, things like that. They are going to try and get you to give them the preferred item anyways, regardless of their behavior. And they're going to do that by having even more behavior, more, screaming, throwing, whatever it is they do. They're trying to push you. So if you give in to that, it's only reinforcing the idea that when they behave this way, they're going to get what they want. Which you don't want. So yes, it usually will get a bit worse. But once they do what you're looking for, in this instance, leaving the park without having difficulties, that's when you really want to drive home the positive reinforcement. So even if it is maybe for the first time, just throw that little party for them. Oh my goodness, you did this. You did exactly what you're supposed to do. You're so awesome. Whatever you want, and because that will stick in their mind. That will stick in their mind more than we're going to take something away from you or that kind of thing. That positive reinforcement is always going to stick out. So then the next time they go to the park, they're going to remember the happy time afterwards, the good feelings that came from them doing what they were supposed to do, and they're going to be more likely to do it again and again and again. I hope that helped a little bit. Behavior is always one of those things that is very difficult to deal with because every child is different. The behavior tools and things like that are great, but until you find what works for one individual child, it's very hard to have a generalized statement. So one child, maybe just clapping and going, wow, you did such a good job, is enough positive reinforcement, where for another child that may not be enough to stick out in their minds to create that effect that you're looking for. So you kind of just have to experiment a little bit, but I do think that making sure the child is prepared to leave, that they know this is happening ahead of time, that they are reminded this is happening, as well as pairing it with some kind of positive reinforcement if they are able to transition correctly. That should help over time improve. Now, like I said, it might get a little worse before it gets better, but as long as you stay consistent, you should see an improvement in that area. Of course. If there's anything else on top of that, or anything more specific you'd like to know, feel free to write it in there. I'd be happy to answer a little more on that. But if not, I'm going to go ahead and move on to my next question on the list, unless anybody else watching would like to ask me anything. Let's see. Okay. So here's a good question. Just pop this up here. So the question is, can an OT help my child sleep at night? And I just saw, in addition to that question, transitions in general, play school, and home. I would say that you can apply those principles I talked about to anywhere, really. Get the preschool teachers or, whoever's going to be watching the school on board, with your plan for transitions, things like that. Make sure they're aware. It may even be something simple like he gets to play with a toy he brought in from home for 5 minutes, as long as he is able to transition, into the preschool without issues, things like that. If it's an issue of he doesn't want to leave mom, that kind of thing, like going to preschool without mom. I know the park's a little different because he doesn't want to leave the park, but if it's more of an anxiety thing, like he has a hard time being away from mom, being in that kind of environment, sometimes a transitional item can be very helpful. So something from home that he, like a particular toy that's his favorite that he finds comforting, maybe something he'll take to bed with him and snuggle with, sleep with. If you allow him to bring that into the preschool, that may have a more calming effect during transitions, things like that. You just have to talk to the people working there, see if they would be on board with allowing him to have it at certain times or things like that. Sometimes that can be helpful too with the transitions, for sure. For the park, it's not quite that, but for a transition away from mom, sometimes that's what's best. But anyways, back to the question on the screen. Can an OT help my child sleep at night? And the answer is an oddly phrased question. So an OT can help with strategies to help your child sleep at night. I don't know if I would directly help your child go to sleep at night, but there are different, one of the biggest things as far as bedtime and going to sleep, things like that, is developing a routine and sticking to it, which I know I'm 27, I don't have kids, and it's hard for me to even stick to a routine. So I imagine that me saying this may not be the most practical thing for, a working mom who has kids or multiple kids or kids with disabilities, that kind of thing. But the best way to help your child get into the routine of going to sleep without issues is just that, the routine. So start with, you want to start maybe 45 minutes to a half an hour before you actually want your child in bed. Just the regular bedtime things you would want your child to do. So maybe brush their teeth, wash their hands, put their pajamas on. You can even throw in something that's more of a preferred activity, something quiet like reading a book to them, or maybe there's a routine where you tuck the stuffed animals in every night before they get in bed. Something that they look forward to, but then they also connect to going to bed, so that the act of going to bed is not that it's not like a negative thing. It's, oh yeah, we get to tuck the animals in now, and that's something they look forward to. You know what I mean? So whatever it is that is motivating for your child, that works for your child, you want to start that routine. You want to do it in the same order every night. So if it's, brush your teeth, then put your pajamas on, then you get a glass of water, and then we read the book, then we go to bed. And you want to start with the same thing every night, move on to the next things, and then end with the same thing going to bed. Also, if your child is nonverbal, or is, the behaviors are starting even during the routine, it may be a good idea to make like a little chart or a little list of everything that they need to do. A lot of children, when they have that visual cue, or maybe they can even take a little marker and check off each thing we do. Okay, we brushed our teeth, we put our pajamas on, we tucked in the animals, and now it's bedtime, check off. Sometimes that can be motivating in itself, just, going down the list and knowing that we did each thing. So if the issue is actually getting them to bed, that would be one of the recommendations I would say for having your child go to bed and, not have that be such a negative experience. If the issue is staying asleep, where maybe your child has no problem going to bed, but they wake up in the middle of the night, that is just, general advice that I would even give to adults. So no screens before bed, nothing that's really visually stimulating or bright lights, things like that. We don't want to do any vigorous activity before bed. We definitely want to start winding down. No more running around, no more, rough play around the house. We definitely do want to do those things, run around outside and stuff like that during the day. But right before bed, maybe like an hour or two before you want to get to bed, we want to make sure those things stop, because those are only going to stimulate them, and it's going to make sleep harder to get to and stay in. You also could try things like the transitional item I was talking about earlier, a stuffed animal or blanket that your child really likes to sleep with, that is comforting. That kind of thing might help them stay asleep. I know when I go to sleep at night, I may wake up several times throughout the night, and that usually isn't the issue, because I'll fall right back to sleep. The issue is when you wake up and, you can't fall right back to sleep for whatever reason. And sometimes that reason for a small child is just they want to be comforted. They want to, either a small animal or blanket or something like that. Also, talk to your pediatrician for sure. Make sure that their sleep issues isn't an actual physiological problem. Make sure that, all the hormones in their body are running correctly, they're getting all the nutrients they need, things like that. Because if it is an issue that, might be able to be fixed through medication or through, that kind of thing, then, all these strategies I'm talking about may not really help. You know what I mean? If it is an actual medical issue that your child is having, where they're unable to fall or stay asleep. So definitely always want to talk to a pediatrician about those kind of things as well. Hopefully I answered that one. If anybody has anything for me, please feel free to type it in the chat bar. Let me know what you want to know. I'm an occupational therapist, if you didn't know. I work with children on a daily basis. Occupational therapy focuses on things like fine motor skills, sensory skills, activities of daily living, so feeding, bathing, dressing, things like that. I also work with behavior. I work with attention, ocular motor function, all that kind of stuff. So if any of these things are kind of ringing a bell for you that, I have a question about this for my kid, feel free to type it in the chat bar. Don't be shy or anything. I promise I don't bite, and I love answering questions for you guys. It makes me very happy to feel like I'm helping somebody. So if there's anything I can do to help you, please type it in the chat bar. I would be happy to answer that for you. All right. If nobody has anything for me, I'm just going to go ahead and move down the list a little more. Let's see. Let's find that list. So people had sent in some questions during the week that I have a list of here. So if nobody has any questions for me right now, and here's a good question. I'm going to put this up, and I may not answer it directly. Hang on, let me put it up first before I start talking about it and it doesn't make any sense. Okay, so the question is, my 9-year-old has just been diagnosed with autism. What should I do to help him? So this is a question sent in by a parent during the week, and I just wanted to put this up because I want to talk a little bit about autism. I plan on making an informational video. Hopefully I can get that up by this week on my YouTube channel, OT Steph. But autism is a very misunderstood disorder by the general population, really. The biggest thing that is misunderstood about autism is that it is a spectrum disorder. It's ASD, if you've heard that term, autism spectrum disorder, which means that a diagnosis of autism really doesn't mean any one thing. Spectrum, kind of think about the light spectrum. You've got, purple all the way to red, and then all of those colors in between: red, orange, yellow, green, blue, purple. So really, when you're diagnosed with autism and it's on a spectrum, you're not just purple and you're not just red. You could be yellow, green, any of those little half colors in between. Someone who has autism may not have all of the signs and all of the symptoms of autism. They may only be displaying a couple or one or two even, but those symptoms are severe enough where they're impacting their functioning. A lot of times I will have parents at the clinic, ask me, should I get my child diagnosed? Should I take them for the testing to see if they have autism? And when they say this to me, there's always that fear and that apprehension in their voice. Like, if their child ends up getting this diagnosis of autism, then it's like a life sentence. It's like, oh my goodness, now that they have this diagnosis, they have this terrible disorder, and they're going to be non-functional for the rest of their lives, and all kinds of stuff. But that's not always the case. So a child with autism could be a completely high-functioning, have a job, get married, have kids, that kind of thing. And maybe there's just a couple little things that are kind of off with them, or they're a little bit quirky, that kind of thing. Autism can also exist on the other end of the spectrum, very severe, where it impacts their daily functioning. It impacts their language, their communication, their social skills. And then for some people it may impact language, but it may not impact anything else. Or maybe this child is able to have really great eye contact with you, and this child is not, but they're still both diagnosed with the same disorder, the autism spectrum disorder. So, when I get a question like this, my 9-year-old has just been diagnosed with autism. What should I do to help him? It's very hard for me to answer that question, because one child with autism versus another child with autism is going to be completely different. I would need a much more specific problem that your child is experiencing. For instance, at the clinic, I see children with autism who have great language skills and great eye contact skills, and they're very intelligent. They do great in school, that kind of thing, but they do have social problems. Like, maybe they don't know how to make new friends, or they have a hard time, understanding sarcasm, things like that. All the way to, I have children who have a hard time. They're very behind in their age level being able to do a puzzle, or being able to learn new activities, put on their socks. They can't tolerate different foods and textures. So like I said, it's a huge spectrum thing. And a diagnosis of autism is not a life sentence. It doesn't mean that, that your child isn't going to grow and progress and things like that. I think a lot of people find that the word autism, they think it's synonymous with something like intellectual disability or mental retardation, and it's just not the case. The autism, the spectrum, it just depends on the individual child, what they're experiencing, what supports they have in their life, of whether or not they, will be able to progress and grow, and just how much they will be able to progress and grow. So, a question like this, I just wanted to throw this up there, saying that, without a little bit more information, a little bit more specific details, it is impossible to answer. So if you have a question about a child who is diagnosed with autism, that is wonderful. I work with children on the spectrum every single day. That is the majority of the children that I do see. I just would need a little bit more specific information, or, a little bit more of what your child is going through, so I can get a better picture of how to help them. Because there's all different kinds of tips and strategies I use with one kid. I could answer this question a million different ways, but most of those ways might not even apply to this child. So that's why I won't attempt to answer a question like this. But if you have a question about a child with autism, please feel free to ask me. Just include more specific information about it. So we're going to go ahead and move on to another question. I guess that wasn't really a question. That was just a chance for me to explain things a little better. Here's a good one. And if anybody has anything, please feel free, type it up in that chat bar. Eventually I'm going to run out of questions on my list, so feel free to let me know what's on your mind. Okay. Here is this will be a rather quick question to answer. It's my 7, I assume they meant my 7-year-old finds it hard to walk for long. Can an OT help with this? And the short answer to that is yes, kind of. I do work with kids on a lot of physical things at the clinic, things like balance, being able to traverse obstacle courses, being able to develop a more confident physical sense of being while, on playground equipment, things like that. However, this sounds more like an endurance thing. So your child becomes out of breath very quickly when walking long distances, things like that. Poor stamina, low tone. I was just looking in the chat bar. But yes, you are correct. Every child with ASD is extremely different. For this question here, if it is an endurance issue, what I would do is I would refer out to a physical therapist. They work more with things like gait, walking, mobility, endurance, strengthening, things like that. So while, if I was seeing a child already who I noticed had low endurance, we would certainly incorporate that kind of thing into our sessions and build up endurance and activity tolerance and things like that. But I would also refer out to a physical therapist because they would be, that's more their niche area, that's more their expertise. So I would definitely want them to be seeing them as well. And Lisa in the chat actually brings up something which I'm not sure if it applies to this question, but it could, the low tone. So poor stamina could also come from something called muscle tone, low muscle tone. I'll backtrack a little bit. Muscle tone is not, a lot of times when you think of that, you think of how strong someone is, how big and bulky their muscles are, and that is a little bit different than the tone. So muscle tone is an underlying problem. It kind of, before the strength and the muscle building comes in, it's kind of how your muscles are stretched just when you're at rest. So when you're at rest, sometimes someone with tight tone, you can feel like they have, if you try and move their arm, there's some resistance there. Someone with low tone, you'll notice they're kind of like floppy. They, very loose. There's not a whole lot of, I keep wanting to say the word tone to describe tone, but it's hard to think of another way to describe it. So for someone with low tone and hypermobile joints, yes, and someone with low tone, that usually it coincides with the low endurance as well, because their muscles are already kind of loose and floppy as it is, which makes, activities more difficult because they have to exert even more energy into those muscles to make them work the same way that someone with a normal tone would. So in that case, if the endurance issue is stemming from low tone, there are ways that OTs would be able to help and teach how to increase muscle tone. Muscle tone will generally increase with more input, more sensory input. So you can increase muscle tone literally just by clapping really loud. The loud sound will actually cause muscles to kind of tense up a little bit. And of course, I'm exaggerating that movement. You probably wouldn't even feel it, but it does happen. Also, things like banging, hitting things, slapping things, rough play, rough movement, all that kind of thing would help increase muscle tone. The effects don't last forever either, but it might help for a child with endurance to stimulate them in some way, maybe even just squeezing their muscles while they're walking, that kind of thing might help to facilitate a little bit more endurance by facilitating more tone in their muscles as well. So hopefully I answered that question. It looks like we have another question coming in from someone who can't watch, but they sent in this question. And this is a great question. So I suppose this is more about my own personal experience than offering advice about a particular child. But the question is, have I ever seen a child with autism and personally felt that they did not have autism? And the giant glaring answer to that is absolutely yes. Autism, I feel like, is one of the most misunderstood diagnoses, disorders of, it's not just black and white. There's no genetic test. There's no actual, there's no distinct features of a person with autism. You would not be able to look at several pictures of children and be like, yep, that's the one who has autism. There's nothing like that. And how it's diagnosed is usually through a series of tests that they give to the child to see their abilities, as well as parent questionnaires, things like that, to see what the child's behavior is like at home. There are a couple key features that autism presents with, but like I said before, autism is a spectrum disorder. So those key features may be present in one child and not another, or maybe some of them will be present but not all of them. And that is very, very misunderstood by a lot of people, and I think it's misunderstood by a lot of physicians too, which is very sad but true. I know in regards to the question, there are cases where I have children who I think there may be something other than autism going on, but they still have that autism diagnosis, which, it is what it is. I think it is a bit over-diagnosed in some cases, but I also, and one of the things that, I struggle with a little bit more, I think, in my field, is it's hard to get a diagnosis of autism for a child who may really benefit from that diagnosis. So I'm in the United States, and a lot of times certain services that can be offered won't be, a child won't qualify for those services without a diagnosis. So insurance companies will not pay for a child to get this specific therapy without a diagnosis of autism. And, I'll have a kid come to the clinic, and in my eyes, it they definitely are displaying a lot of the signs of autism. So I will refer out to a testing center, and I will send a letter saying, this is what I'm observing, this is what mom's telling me, can we please get this child evaluated to see what's going on? And the doctor will say, well, the child's looking at me in the eyes, so they definitely don't have autism, so we're not going to get them evaluated. That's silly, because children with autism don't have eye contact, and they have eye contact, so that means they don't have autism, which is it's absurd to me, because just because a child can look you in the eye doesn't mean that all of these other issues that we're struggling with and that's impacting their functioning on a daily basis, that doesn't mean that they don't have autism, because like I said, autism is a spectrum disorder. And eye contact, yes, that is a feature, but it is not present in every single child who has autism. So yes, I see children who have a diagnosis of autism where I'm like, I don't think that's what this child has. And then I see children who can't, or they're unable to get that diagnosis because they're missing like one or two key features of the diagnosis, and that's equally as frustrating. So I do see that a lot, and I know that right now it is a big thing, the overdiagnosis, the rising rates of the diagnosis. I forget what the last number is. Is it like 1 in 48 children are now diagnosed with an autism spectrum disorder? That's kind of off the top of my head, but hopefully I have access to the internet. Let's see. Autism prevalence. So currently, and I'm just looking right now, here, I'll flip it over. I am on the Autism Speaks website, which is a very good resource, actually. I use this one quite a bit, which is why I'm on it. I trust it. But according to this, April 26, 2018, the autism prevalence has increased to 1 in 59 children. So it is a little better than the 1 in 48 I was trying to say off the top of my head. But still, that's a lot. And that has increased quite a bit. Autism prevalence by 15%. So, and it continues to increase. So, and I do think that some of that increase that we see is due to false diagnoses, due to doctors who, any child who is now displaying any kind of developmental milestone delay or things like that, oh yeah, that's autism, regardless of, if they display any of the key features. So it is a huge problem. I think both ways it is a huge problem, and it just comes from how misunderstood it is, I think, from everybody. There's professionals out there working who don't understand. There's parents with children diagnosed that don't understand. That's why, hopefully soon, I am going to make not a super in-depth video, but at least a quick little overview of the autism spectrum disorder and just what I've learned from it through my experience working with children with autism, as well as my schooling on the subject, that will hopefully be a good resource for people who are, confused about it, because you're definitely not alone. It is a very misunderstood disorder. So yes, hopefully that answered that question. Let's see. There's another one that just came in. Okay. So I'm going to pop this question up real quick. So this is quite a long one. I'm hoping I can, here. Let's see, does that make it any better? If not, I'll just read it out loud and hopefully that will help. I don't know if you guys can see that, but it says, my 6-year-old daughter finds it very difficult to climb stairs. She's been trying a lot, but she always wants someone to hold her hand or just needs grip the stair railing. Also, I can't manage to teach her how to jump as she's terrified. Any advice? Unfortunately, this is another one of those questions that is in the realm of physical therapy. As far as the jumping, the fear of jumping, really, the best way I can kind of help with that part a little bit. The stairs, not so much, but for the jumping, I've had children before who had fear of jumping and fear of any kind of, strong vestibular movement up and down. And the best way to address that is to start slow. So if you think about it, jumping up and down, your body is moving up and down at a very rapid rate. And it could be that your child does not like to experience that feeling of bouncing up and down. To them, it may feel kind of like being on a roller coaster, which, a lot of people don't like that sensation. They don't look for that sensation and they avoid it. So what you want to do is to get your child used to that sensation in a way that they can tolerate, that maybe they won't necessarily like it, but they can tolerate it. So maybe on a trampoline. So if you have access to a trampoline or something like that, and you're able to bounce your child very slowly and in a controlled manner and see if they will tolerate that, and then we want to move up to a little bit more quickly, a little bit more, maybe, you bounce them and then one time kind of let them come up in the air a little bit and then let them calm down and then try it again and again until your child gets used to that feeling of the up and down motion, because that actually stimulates your vestibular system in a major way, the bouncing. You can also see, if your child is also scared of things like swinging, a lot of times those kind of things go hand in hand. If they're afraid of the bouncing, they're also afraid of swinging. Any kind of movement where they're not in complete control, they may exhibit some behaviors or signs of fear. And like I said, the best way to handle that is just to start slow. So maybe put your child in a swing, but don't fling them around just yet. Just nice and slow. Maybe hold on to that swing and just move it back and forth and gradually increase the amount of input that you're giving them so that, their body learns to tolerate it a little better. They learn to be more confident with it so they're not so afraid. And hopefully that would help with the jumping as well. As far as the stairs, that, like I said, the physical therapist would know a lot more about actual gait, the way that your foot is supposed to step on a stair. They would be able to watch your child to make sure that their body mechanics are all working and in proper position for going up a stair, to see if maybe the reason they struggle is a physical reason with their gait or their step pattern. Unfortunately, that is not my area of expertise, so I would feel a bit stepping out of my comfort zone trying to answer something like that. I'm not even sure if I would have the information or the knowledge to address that properly. But if you're able to speak to a physical therapist about it, or even better, to have a physical therapist actually look at your child and watch them climb some stairs to see what's actually going on, that would probably be the best way to address that. As far as holding the railing goes, I don't think that's a huge issue at 6 years old. I know much older children who prefer adults even who prefer to hold on to a railing when they're going upstairs, just, for that extra added stability. But if they really are having a hard time getting up those stairs, I would recommend a physical therapist evaluation, or, maybe you can find someone with a little bit more knowledge in step patterns and gait training and things like that for that question. I'm very sorry. I wish I could answer that a little better for you, but unfortunately I do not have the answers for you. All right. I think, let's see. We've been on for almost an hour. I think I will do one more question, unless anybody else has anything. And those are very good points, Lisa. And like I said, that's just something I would need to see the child for. I wouldn't want to recommend a sensory integration program for a child who, may just have improper instep when they walk or something like that, because that wouldn't be appropriate way to fix that. So, unfortunately, not knowing the specific reason she has a hard time getting up the stairs, I would want, her to be evaluated by someone so they could determine that reason before recommending something like that. Alright, let's see. I'm going to do a quick 1 minute break real quick. If anybody has any other questions, please type them in the chat bar. If there's nothing there when I get back, I'm going to pick one from my list. We're going to do one more question, and then I think that will be the end. But let me throw up the quick break screen, and I will be back in just a minute. Thank you, guys.